if you were starting in the industry now,
Yeah.
and you know, principally you've been trained and you're confident on fillers and toxins, what would be your sort of roadmap, do you think? How would you move forward?
Well, for me, there's kind of two different routes, and it depends on whether you just want to run and operate that business yourself, i.e. just develop and extend the services that you offer personally, or whether you want to incorporate other people into your business who will offer other services. So generally the traditional model now, and the one we operate in our clinic, is having our injector who just focuses on injectables.
Your clinician?
Our clinician, yeah, and he loves that, and he's very good at it.
Yeah. And
total facial contouring as a concept, being able to reshape a face with toxins and fillers at that advanced level, is appealing and is certainly profitable if you can bring in the right people.
And so, roughly, so patients he sees,
yes,
how long does he see them for, and what would, you know, what would the average patient be having? Toxins, fillers, and what would the cost of that treatment be?
And it will vary. So for us, for instance, for one area of toxin, if somebody comes in, we give them a half-hour free consultation for us. Well, actually, we do have within our clinic now, for our doctor, we'll charge £75 for a consultation.
With your...
But that will be reimbursable if they go on and have a treatment.
Okay. So let's say I'm coming to see you.
Yes.
So I phone Medizen. Who will I talk to first?
You'll talk to receptionists.
Yeah.
So obviously your receptionist and their level of training and understanding around especially your price points is important for us, because we charge 235 for one area.
Yeah.
And in Birmingham we have non-medical people who are charging £60–70.
Yes.
So what we have to do is to credential our clinic and how we operate, so that people understand why they might be paying £235.
So if I phone you up, Ron, is your receptionist going to say, she's going to tell me, will she discuss finances there and then?
She won't. If somebody just wants to book an appointment, that's fine. We just take the appointment, look at the right, you know, trying to get the most convenient time for that individual within our...
So I phone you up,
she'll
give me lots of information,
yeah,
fit me in.
Yeah.
How much will that appointment cost me?
£75.
Okay.
Yeah.
How do I pay that?
Via a credit or debit card over the phone.
Okay.
Yeah.
Do people have qualms about?
They do indeed, but from our point of view, because we value our practitioners' time, and because I guess we're a little bit more sophisticated in with our presence in the market, we feel that way it pretty much guarantees that the patient will arrive. If you don't charge anything, you can't guarantee that.
Yeah. What percentage of people do you think will not arrive if they don't?
Oh, you're looking at 5% or something in that order if they paid. Yeah. If they haven't paid, a lot less. I would say probably in the order, before we did that, you were looking at around 20% of people not turning up.
Actually not turning up,
yeah. Something would. It's been a long while since we've been charging now, probably 5 years.
Yeah.
Yeah.
Okay. So they pay £75. What do they get for that 75?
So for that £75, they get David's professional advice in a consultation, and he will obviously look at what their needs and requirements are and look at whether or not he can realistically provide that. So it's professional advice.
Yeah.
We will refer if, for instance, if somebody comes in and they say, I've got hooded eyelids and will Botox work for that, and we go, well, no, you probably need to go and see a surgeon. We will probably give a list of 3 surgeons to go to talk about that.
Yeah.
But generally for most people they are suitable, and as long as we've gone through obviously the medical consultation and consent side of things, we will then book them in for a treatment.
Do you take photographs of them?
We do. We photograph everyone. So
everyone who comes in?
Absolutely, yeah. So in general what we will do, that will be part of the overall consultation experience. So they'll come in, and for us we have a Visio skin analysis system. So they will see usually one of our receptionists will go in and take that photograph and just explain what the different parts of that are, because with Visio it looks at other things. Yeah,
so just run through it again. So I paid my £75, I arrive at your clinic.
At least half an hour before, come in, you'll be given a cup of tea or coffee if you want it. Yeah. And then we have certain check-in forms as well. Yeah. That we need to kind of look at alongside terms and conditions. So that's quite important from our point of view.
Patients do that themselves, or they do it on an iPad? Or?
They do that themselves. We haven't gone to a digital route yet within our clinic. So we have paper that they kind of sign. They'll be guided through that if they have any questions. Yeah. But in essence as well, because we're Care Quality Commission registered, we need that down as well. Other clinics
Okay.
won't necessarily need to do that.
Yeah.
They have photograph taken before
On the Visier?
on the Visier, and then they will have that printed out.
So just to be clear, people may not have heard of the Visier. The Visier, can you just clarify what it is?
Canfield offer a digital skin analysis system, and this is a brand called the Visier. There are other devices out there that do similar things. I think Canfield is probably one of the top of the range pieces of equipment.
It's American, isn't it?
It's an American system, yeah. And in essence, what it does, it takes several photographs that look at a surface image, which is great to have anyway, just looking at what your starting point is. And then it looks at what's beneath the surface of the skin as well. So it looks at pigmentation, it'll look at redness,
sun
vascular,
damage,
sun damage, that kind of stuff.
Quite
as
scary,
well.
actually.
It is quite
when you
scary.
put your face in it, isn't it? Yeah.
It is, but so it has two functions.
Yeah.
It gives us a base image that we need to understand. So from a point of view, if we go on and do other further treatments, at least we know what we start with. So if there's any issues from a point of view of them saying you did this and you did that, we know where we stand.
So the Canfield's great because you can analyse, pigmentation, sun damage, blood vessels, and you've got a baseline for those things. It's absolutely great. Now, for people, how much does a Visier cost?
I think it's around £15,000. So
was that a good investment for you?
For us, yes, because we utilise this as a selling tool. And so for us, we develop our concept. And as I said, we have our injector who does the injectables, and then we started off with one therapist, and now we have 6 in our clinic.
6 in your clinic,
who do all the rest.
Yeah.
And the natural additional services that you will build around injectables obviously revolve around improving the skin and complexion.
Absolutely. So they come in and have the Visier. Now, if people do not have the Visier, they'd still be photographed.
An iPad, a digital camera of some form or another is, I think, important. It's important to photograph anyone before. Well, maybe not if you're not going to go on and treat them. It's not important. If you are going to go on and treat them, you definitely need a baseline photograph.